Hello all, this is Medical Johnny. Let's continue with some C's. Okay, got my stethoscopes. Now it's official. So, Central Processing Unit. Central Processing Unit, which is the computer brain where information is stored or directed to appropriate pathways. Central Processing Unit, the brain of the computer. It's where all the other stuff goes out. Cerebral spinal fluid. Cerebral spinal fluid. So think of it, spinal fluid. The fluid that circulates around and within the brain and spinal cord. So there's a coating layer of liquids that floats, keeps things from grinding and everything like that. And it's cerebral spinal fluid. Cerebrovascular accident, CVA. A cerebrovascular accident, which is a stroke, blockage, or bleeding of blood vessels in the brain, interrupting the blood supply to the part of the brain and damaging the surrounding area of the brain. So a stroke is something in the head that went wrong in the blood system, and a part of the brain is not working. It's being ineffective. So that's CVA. Those are the abbreviations of CVA, cerebrovascular accident. The way you can remember this is cerebro, right? But then vascular. So with the vascular, you know it's in the veins, and then cerebro is like in the head, like your cerebro head. So cerebrovascular accident, CVA, is a stroke, blockage, or bleeding of the blood vessels. Okay, so chair alarm. A chair alarm, a battery-operated control unit that activates an audible alarm immediately if the patient gets up and out of the chair. So with this, what it is if a patient is not supposed to be getting out of like a wheelchair or something like that, just like you had the pressure-sensitive mattress, if they get out of the wheelchair, it sounds an alarm, hence the name chair alarm. It sounds the alarm and lets nurses or something like that, the CNA, the doctor, whatever, and alerts them, whoever's nearest, that they need to come help because this person's getting out of the chair. Maybe either they need to use the bathroom, or it could be confusion, dementia. CNA people will be working with a lot of those. And you know how you're supposed to, in CNA, sometimes take people for walks. For example, if you ever watch like movies or anything, you see how they're always wheeling people around the old age homes. Well, if those people have a chair alarm and they get out of the chair, then the alarm goes off. Chemotherapy refers to the use of drugs to treat cancer. It's chemotherapy. I would go more in depth for that, but there's different chemotherapies from what I understand, so I'll leave that one. But just, you should pretty much know that chemotherapy is the treatment of cancer. It's a widely known thing, so it's not that hard to understand. Cheyenne, C-H-E-Y-N-E, Stokes respiration. Cheyne-Stokes respiration. I'm not quite sure how to pronounce that. One kind of irregular breathing. At first the breathing is slow and shallow, then the respiration becomes faster and deeper until it reaches a peak. The respiration then slows down and becomes shallow again. The breathing may then stop completely for 10 seconds and then begin the pattern again. This type of respiration may be caused by certain cerebral, like our cerebrovascular accident, may be caused by cerebral, brain, cardiac, heart, or pulmonary lung diseases or conditions. So it's a pattern of breathing that goes stop for 10 seconds and but maybe throughout a long drawn out time. And these are here's some keywords that you should know, because we were talking about our cerebrovascular. So cerebro is head, and then vascular is the veins, remember? So cerebral is brain. Cardiac, remember, is heart. Cardiovascular, cardia, remember from the few videos ago, is heart. And pulmonary, from one of our words, remember CPR, cardiopulmonary resuscitation. So heart, lung resuscitation. So pulmonary is lungs. So those three: cerebral, brain, cardiac, heart, and pulmonary lung. And this is Shane Stokes. I'll write it down like with all the other vocabulary so you can kind of see. Chronological age. Chronological age. Actual age in years and months. So chronological age is just it's not the down to the day, it's years and months. So for me, for example, it would be like, it wouldn't be May 16, 1990, 1994, something like that. It would be 05, 1990, 05, 1994, 95, 09, 63, you know. It's just the age in years and months, not with days. Okay, circulation. Circulation. You should know this. Very easy. The continuous movements of blood through the heart and blood vessels to all parts of the body. Okay, so you're getting the circulation of blood. It's going all the way through. There's no stopping. When you have your cerebrovascular accident, the circulation is not good. That's why you had the accident. Your circulation is where it goes all throughout the body. And it's just, remember, it comes in through the veins, through the heart, and then it goes out through the arteries, comes back through the veins, etc., etc. Circulatory system. Since we're dealing with circulation, the circulatory system is the heart, blood vessels, blood, and all organs that pump and carry blood and other fluids throughout the body. So everything that's making this round trip throughout your body starts with the heart, goes down, goes through your leg, comes back up through the brain, that kind of thing. There's just a big circle throughout your body. Everything that goes through that is the circulatory system. And it's not just blood, as it says here, it's other fluids throughout the body. So remember yesterday we were dealing with other fluids that either lubricated or they recycled, that kind of thing in previous videos. I keep saying yesterday, but I should say previous videos. Remember, those also had things that went through the blood. It wasn't just blood, it was also things that went through the blood. So those are part of the circulatory system as well. Circular is circle, so just think of your body as everything's going around. Circumcise. Circumcise. This is a very big topic in the political and religious arena. Circumcise is to remove the foreskin of the penis by surgical procedure. It doesn't just have to be when you're a kid. I know, for example, the famous martial artist Bruce Lee had his father circumcise him at age 18. It's just a penis has extra skin when you're born, and you stretch that out and surgically remove that with like scissors or a knife or some kind of surgery. And many of the pleasure senses are now gone from the penis. It's where a lot of the pleasure senses are, like a lot of the nerves. And so it's extra skin at the tip of the penis that doesn't touch the head of the penis. It actually folds around the head. And then that can be taken off, and that is circumcision. And to cut that off is to circumcise. Clean catch. Clean catch refers to the fact that urine for this specimen is not contaminated by anything outside the patient's body. So clean catch, when you've caught the urine clean, there's no accidentally just Tabasco sauce caught in it for some reason. I accidentally didn't put my finger in it while I was getting it. You cleanly got the specimen of urine into a container that can now be tested, something like that. I know they do urine tests for drugs, to see if you have any marijuana in your system. So hospitals sometimes do that. You can pay to have that done. Sometimes businesses do it. So it's a clean catch if you got it correctly into a container without any contaminations. Client. A client is an individual cared for by a home health agency or provider. So the people that you are helping, this is not just a medical term, this is a business term. If you are helping somebody and they've paid for your help, they are a client. A closed bed. A bed made with bedspread in place. So basically a bed that hasn't been contaminated by somebody jumping all over it and getting inside of it. So a closed bed. An open bed, think of it, the sheets are closed, ready for somebody to open it and get in. So it's a closed bed. Clove hitch. A type of knot that can easily be released in case of emergency. A clove hitch. Cognition. This is a very important word because half of your patients will be cognizant, half of them will not be. Cognition is if you are aware of something. It says here, awareness, the mental process by which knowledge is acquired. You are cognizant right now because you are taking in things that I'm saying. You are listening to me. But if you were just sitting there with drool dripping out of your mouth, you are incognizant. You are not taking in anything. You are unconscious, basically. So cognition. Very important that you know that one. And then with cognition comes cognitive, pertaining the mental process by which knowledge, perception, memory, or judgment is acquired. So there's a word called sentient, where you have knowledge about everything that's going on. You are able to say I am. Usually you don't think of a dog being able to say I. The dogs wouldn't have the mental capacity to do that. And I need to be careful because there's a dog sitting under my chair. But just saying I am, as Rene Descartes said, well, I just lost my train of thought. He says, I think, therefore I am. He is cognizant. He is sentient. He is cognizant of what is going on. So let's go through these words, stop the video, and see if you can remember what they are. Central processing unit, cerebral spinal fluid, cerebrovascular accident, chair alarm, chemotherapy, Cheyne-Stokes respiration, chronological age, circulation, circulatory system, circumcise. Here's one I missed. Circumference, the distance around an object or body such as the head. So circumference. You should know what circumference is. I'll go over it in the next video. I'm seeing on my timer I only have 30 seconds left. So clean catch, client, closed bed, clove hitch, cognition, and cognitive. So in the next video, I'll be starting with circumference, and then I'll go to the next ones. This is Medical Johnny signing off.